How long do you wear on an initial bandage for after pinnaplasty surgery? Once the initial bandage is off, do you wear a headband day and night or just at night, and how long? This needs to, we do pinnaplasty at the clinic, but I don't do it. The other surgeons do it, and I haven't done it for a long time. Surgeon specific. This is kind of up to the surgeon, and you'll find that surgeons will all have different views on this, which kind of implies there's no kind of right answer to this question. So when I used to do it, I used to do a head bandage for a week and then a headband at night for a month. So, you know, so that in answer to your question, that's what I would do: bandage for a week and then the headband just night, not day, for a month. That would be my regime, but everyone's different, and it seems to me that the regime is going less bandages these days. So they're going less and less. The sort of dressings are getting less and less because a head bandage is quite a big deal, and it's quite, you know, you have to sort of hide away for a week because you kind of look like you've been in the war with your head all bandaged up. So it seems to me that people are moving away from head bandages. It does depend a little bit on the technique used. So if you're using a kind of scoring, there's two different ways of doing it. Broadly speaking, there's a way you can score the cartilage and remold it, a bit like if you have a bit of cardboard and score it, it'll like bend away from the scores. And that way you do need to perhaps and that's the way I used to do it. Well, I've done it both ways, but that's the main way I used to do it. And you do have to keep that mold in place. So that's when your head bandage is important. A lot of people, well, it seems to be sort of becoming more popular to use the suture technique, where you put some sutures to the ear to sort of pin it back. And that you need less, it's less kind of molding. Excuse I. You don't have to deglove the ear so much and all sorts, so less of a need for the head bandage. So I think those guys are using bandages less, and sometimes just it's hard to put a little dressing on the ear. It's either a big head bandage or it's kind of nothing. So but I think they're moving towards kind of nothing and maybe just head bandages and things from the start, which is certainly a lot easier for people who are having the surgery, but it is very surgeon specific. So probably my regime is a bit old-fashioned, and well, I don't know whether it is or it isn't, but it doesn't really matter what my regime is because I don't do it anymore. So it's really up to the surgeon who does it as to what sort of dressings you can have on there.